Hello and welcome. You're watching our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. This is a show where we get you all the latest on the pandemic. Now, India reported 91,702 new COVID cases in the last 24 hours and 3,403 new deaths in that 24-hour period. Though the deaths, some of them have been added from Maharashtra after a review of the death numbers. The country vaccinated 32,74,672 people in the last 24 hours. And India's test positivity rate, that's positive cases identified for every 100 tests, continues to decline. So some welcome news there. It now stands at 4.48%, the fourth straight day that it is below the 5% mark. So welcome news on that front. But let's take a look at another big worry. Over 31,000 cases of mucormycosis, or black fungus as it's popularly called, have been reported across the country so far, with Maharashtra topping the chart with over 7,000 cases, followed by Gujarat and Rajasthan. Maharashtra had also reported the highest deaths, over 600 so far, due to mucormycosis, followed by Gujarat, and in Karnataka, with over 2,100 people losing their life due to the fungal disease across the country. Coronavirus patients with diabetes and a weakened immune system are particularly prone to the attack of this fungal infection. Well, let's now focus on a promising treatment for coronavirus. That's monoclonal antibodies treatment that was introduced in India a few weeks ago. It's already been used to successfully treat some high-risk patients, leading to doctors describing it as a game changer, as it can avoid hospitalization in high-risk groups and progression to severe disease. It can also help in escaping or reducing the use of steroids in patients. Remember, that's quite significant, given that the use of steroids is being linked with so many other problems that happen later, including cases of black fungus or mucormycosis. The costs, however, for this treatment remain very high. It costs 59,000 for one dose of this treatment. Well, to talk more about this, we're joined by Dr. M. Vali, Senior Consultant at Gangaram Hospital. Thank you so much for joining us, Doctor. So, tell us about so far the experience with monoclonal antibodies. It first became famous when it was used last year for then President Donald Trump in the United States, but now it's been introduced in India a few weeks ago and it's been successfully used in a few cases.
Yes, thank you very much for making me part of this program, and you have chosen a very nice topic which is very relevant, and as you said, steroid use can be minimized with this, and we had the first evidence coming from Medanta, the Medicity, where it was used on a patient of 84 years, and now very recently, Sir Gangaram Hospital, my colleague Pooja Khosla had successfully treated 2 cases. Maybe the number might have increased by today. So this is a boon. This is an antibody, and to be more precise, 2 antibodies. That is why we call it antibody cocktail. And these are named as casirivimab and indivimab, and these are used together. And the dispensing is also very easy. Either they are available in vials, and they can be used subcutaneously more commonly, and they can be used or infused intravenous also. The factor of the cost, which you had rightly pointed out, is around 59 to 60,000, but that justifies the patient's stay in the hospital and ICU is minimized because it is used in the very early part of the disease. It can be used in most of the people who weigh 40 kilogram and above and age 20 years and above. And this was being tried, as you said, in US. The most important point in using this antibody cocktail is that patient's recovery is very fast. And usually this should be an outdoor procedure, but patients can be kept for observation and they are discharged next day, as we did in Gangaram Hospital. In Medanta, the Medicity also, they kept the patient for a very short time and they discharged the patients on the same day.
Right.
So this is the same antibody as you told that Mr. Trump was given, and it is a new boon for India, and Roche and Cipla have started marketing it, and Cipla has a lot of good things to do, and I hope Cipla would consider reduction of the cost.
Absolutely. We're joined by Dr. Praveen Chandra, Chairman, Interventional Cardiology and Structural Heart Disease, Medanta. Sir, if you could tell us, Medanta is where I think it was first used, this antibodies cocktail treatment to treat somebody who in the early stages of COVID. If you could tell us more about what the experience has been in the hospital so far, and are we hopeful that soon we could see the cost coming down, because so far it can only be used by, middle class, upper middle class, or if the government provides it for free?
Okay, so you already heard something, some information Dr. Wali has already shared. Now, in our hospital in Medanta, we have used in more than 20 patients now, and the results have been quite, nice. And all these patients were sent home the same day. It was given as an intravenous injection, and we keep the patient for about half an hour to 1 hour, and after that they can go home, and then the follow-up is done at home. And none of these patients actually progressed for any severe disease, and none of them needed oxygen therapy also at home. So which means that this drug is effective in the initial stage of disease, which means when the virus has just entered, it is like, when the spark stage, when the fire has happened, that is a full-blown COVID when it is already 8, 9 days, 10 days. But when the spark of COVID is there we are trying to extinguish this spark so that the disease does not happen. It is like that. So it is a very effective treatment. It works very well in most of these situations, but the only catch is that it has to be given early in the onset of disease, and in those patients where the risk of disease is high.
So you give it to the high-risk patients so far, at least that, because, because of the scarcity perhaps of doses, so far we're just giving it to those patients. But Dr. Chandra, also there has been some questions raised about how effective it would be against variants. What can you tell us about that, given that we now have the Delta variant, which is dominant here? How does that affect the effectiveness of monoclonal antibodies?
Okay. So there are, on two bases, we can say that it could be effective in the variants also. One is that this is a combination of two antibodies, which means that the spectrum of this is broader than just giving one antibody or than just giving plasma, because plasma is just one antibody from a single patient. It is not a pool. So here we are pooling two antibodies and making them as a broad spectrum treatment for those patients who are having this even with variants, number one. And number two, in patients where these variants have affected, especially in India, although the number is smaller as of now, but we have seen effectivity of this agent in these patients also who were affected by variants.
All right, so that's welcome news, because it is being called a game changer by some of the doctors, who've seen the effect it's had on their patients. Dr. Wali, now we do know in the US, however, the use of monoclonal antibodies has come down because they've managed to cover such a large proportion of their population with vaccines. But given that in India, we're still seeing a very, very slow pace of vaccination, and that's a huge worry. This is a very welcome, intervention, a very welcome treatment for COVID.
Yes, thank you. Your channel is already doing a very good program, Vaccinate India, with Google, and I was part of it this afternoon also. So we have to motivate the people to get vaccinated, and before that to practice COVID appropriate behavior, not to forget to use masks as people are being less serious about it. So we have to actually concentrate on the primary prevention methods of COVID, which are duly advertised and being known. By now, everybody knows. You see, nobody can claim that I don't know. So before going to drugs, costly drugs like this, and I must also add a point with permission of Dr. Chandra, that the multi-dose vial also were being procured in Medanta Hospital to minimize the cost. And this is a very useful tool. But to reach to this stage, we have to suffer with COVID. So I want my country's youth as well as the elderly people, especially children also, should not suffer from COVID. And we have been talking about third wave to come, and we have to work so hard that third wave should not come. And for that, the easy things to do is wear mask regularly, follow the distance, appropriate distance. It may be more than 2 meters, and practice hand wash, COVID appropriate behavior, which is being slackly practiced these days, I'm seeing. And please, please, you have showing the complications like black fungus. Just now you spoke about it, it is increasing. So when there will be no COVID, there will be no black fungus. So this can be interrelated complication which we can minimize and prevent deaths further. And today I was very happy to listen G7 countries have announced a lot of vaccines for the countries, and especially you
no, absolutely. We need to do, encourage more vaccinations, and hopefully we will see, the doses shortage being rectified. But Dr. Chandra, if we talk about monoclonal antibodies, how widely available is it in India? We know Medanta has it in some top hospitals in Delhi. But if we have a viewer who's watching, from a small town and they have an elderly person who they're worried about, how easy is it to access this treatment?
Okay, so as you know, in all the major cities it is available, and it is coming in phases actually. So in the first phase they chose hospitals which could initially handle it and see the reaction of this agent into our patients. So everything seems to be all right, and I'm sure Cipla, which is the company which is the distributor of this particular medicine, will certainly, and Cipla has a very big reach inside India, so they will provide it to most of the places where it is definitely required. But at that time, Delhi and neighboring areas were very seriously affected. So probably they tried to put it in those areas first where it was really required.
All right. Well, thank you so much, Dr. Vali and Dr. Chandra, for joining us on this very, very important issue and this promising treatment that is being called a breakthrough by many of the doctors here. Now let's focus on Europe, and across Europe the pandemic is receding and people are starting to see some semblance of normality return, yet the optimism is the cautious kind, and governments are facing the dual challenge of meeting their vaccination responsibilities both for their populations and those around the world. Well, let's get more now from William Glucroft in Berlin, who's a correspondent with our partner DW. Thank you so much for joining us. First and foremost, tell us, how are things where you are?
Well, summer has finally arrived to Germany and all around Europe, and people want to get out to enjoy it. And the pandemic for now seems to be cooperating. All the bad numbers are down, infections, hospitalizations, deaths, and the good numbers, vaccinations, are up. At least 46% of people in Germany have at least one dose. About half of that, they're fully vaccinated. And similar numbers are all around Europe, and that's allowing places to open up. Of course, it's different all around Germany and even all around Europe, of course, but generally restaurants and places to drink and eat, they're open, even for seating inside with tests. Mask use, of course, is still required on public transport and generally out in public. And of course, employers still have to, at least here in Berlin, have to allow working from home, and they have to allow employees to be able to get tested for those who have to come in. So a lot of progress being made, but still a lot left to go.
And what concerns remain for officials there?
Well, we were here last year, of course, when the incidence rate went down, where things seemed to be more relaxed, only to get hit again with the second and third waves in the fall and the winter months. So officials don't want to repeat that now that people are getting out, going to travel more. Rules are relaxing. And it's important to note that although the numbers are down, way down from what we saw over the winter, they're still higher than this point last year when there was that lull. They're actually about where they were in parts of the first wave that, of course, shut down so much of Germany and Europe. So it really is a matter of perspective. It is all relative, of course. Things feel good in comparison to those dark days in the winter, but we're still not where we need to be.
And what attention is vaccine distribution getting for other parts of the world?
That's right. Now that things seem to be more relaxed here, more open, things to be going in a good way, especially with vaccinations here in Germany and across Europe. There's even more pressure for rich countries to be helping lower and middle income countries get the vaccines they need to end the pandemic everywhere, not just here. The WHO, for example, says that 75% of all doses worldwide have gone to just 10 countries, with less than 1% going to lower income countries, countries with low GDP. And they want, of course, to change that primarily through COVAX, the initiative to get vaccines to lower and middle income countries. There was, of course, a donor conference recently where they raised a surprising $2.4 billion, more than they were expecting, which was very good for COVAX. They think that can get enough doses to at least cover 30% of populations in 91 countries by early 2022 at the latest. But again, there's a lot of short-term shortfalls that have to be made up, especially with India having supply problems in its own country to take care of. There's hundreds of millions of doses still left to get to COVAX, to those lower and middle income countries. And Europe needs to step up and make sure that it is fulfilling its responsibilities and fulfilling its pledges that it's giving.
All right, William, thank you so much for joining us again on NDTV. Now for our special campaign, Vaccinate India, in partnership with Google. And we discuss questions that you have about vaccines and COVID, questions you look up online, questions that you often Google. Well, to answer those questions, we're joined again by Dr. Praveena Chandra. Thank you so much for staying on with us, Doctor. One of the questions that's Googled a lot is, how can I prevent COVID?
Okay. So, sorry. So the most and the simplest and the easiest way to avoid COVID is use masks. Sorry. And do masks and doing sanitization of your hands on a regular basis, and also staying away from the other person by about 2 meters is always a good idea. And I think that is the first step for staying away from COVID, because COVID has 3 stages. One stage is when it is not entered your body. The second stage is when it has entered the body, and the third is when it is making a disease inside your body. So the first stage is that to stay away from COVID is to just maintain these 3 things. It is cheapest, it is easiest, and it is very easily done, but you have to practice it.
Right, Doctor. Now, over the year and a half, we've seen, the thinking around how COVID spreads has evolved in the sense of, how it travels through the air. And ventilation has now become a very big focus in trying to prevent COVID, especially as we open up and people are returning to offices and in somewhat, more crowded sort of environments.
Yes. So the precautions and the preventive steps which we have to take as things are opening up, as people are joining offices, they should not be crowding together in a small space. In case the space is small, they should kind of ventilate it, and it should not be remaining closed that 5 people are remaining in a closed space for a long period of time. So the duration of exposure is also very important. So any duration of exposure which is beyond 15 minutes, we have to make sure that the ventilation is adequate, the air circulation is happening, and people are not very close. And if they are there, they should be wearing masks all the time. There is no, discount or any bargain on this, that they should continuously remaining to use masks, even if they are in offices, even if they are, and they should not be eating together. That is another very common thing which is happening.
Yes.
When people come together in the office, they come very close to each other, and they start eating, having tea or coffee, etc. That is the time when it can travel. So they should remain away. They should have meals separately.
Absolutely. And of course, get vaccinated as soon as you can, because that's one way of preventing or avoiding COVID. Another question that's Googled very often is self-care during COVID. So my understanding is when you're sick with COVID, how do you take care of yourself? What should you do?
Okay. So the first step, whenever somebody develops fever or extreme lethargy, weakness, or symptoms of common cold, in that situation, what they should do is immediately they should isolate themselves. That is the first step, because people at home will get infected very easily. So they should isolate themselves in a single room. They should measure the temperature. They should take paracetamol if the fever is going above 100 degree, and also get a RT-PCR test done as soon as possible once this symptom is there. Do not take steroids, do not take any other medications unless until it is proven that it is a COVID infection. But till then, he has to remain as a suspected person. And once the test is done, then one can take a decision whether to stay at home or to be admitted in the hospital.
Right, and it's very important, doctor, to be, monitored by a doctor during this time. No sort of self-medication, no sharing of prescriptions that may be for another family member. And, everybody needs to consult a doctor for their own situation and ensure that they take medications only after the doctor has, advised it.
Absolutely. So because self-medication has been very common in this wave, in the second wave, and that may be one of the reasons that we are seeing more complications, more chances of fungal infections, etc. So that is why it is recommended that no medication, even if these are multivitamins, are not that much recommended. Although initially everybody thought that multivitamins will be good, but we have seen that they have not made any big difference. So there is no need to take them unnecessarily. The only important medicine is paracetamol, and that is only to be taken if the fever is going above 100 degrees centigrade. That is 100 degree Fahrenheit. And the other is that the medications like steroids, definitely should not be taken unless until it is prescribed by your physician.
All right. Well, thank you so much, Dr. Chandra, for joining us.
Thank you.